Good morning to everyone, to Lazaro Manuel, who joins us today, to our sign language interpreter, and good morning to everyone tuned in to this briefing. Today, 1,729 people are hospitalized in Cuba. 67 are under observation. There are 1,086 suspected cases and 576 confirmed active cases. Yesterday, we processed 7,380 samples in our various molecular biology laboratories. 2,122 of the samples were processed at the Pedro Curry Tropical Medicine Institute, 908 in Havana's Hygiene, Epidemiology and Microbiology Center, 817 in Villa Claras, 284 in Santiago de Cubas, 586 in the Genetic Engineering and Biotechnology Center Lab, 584 in the Molecular Immunology Center, 458 in the Hermanos Almajeras Hospital, 386 in the Manuel Fajardo Hospital, 368 in the Naval Hospital, 344 in the Civil Defense Laboratories, 322 in the Fructuoso Rodriguez Hospital, and 201 in the ICA laboratories. Of the 7,380 samples processed yesterday, 42 tested positive for COVID-19. That's 42 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 492,527, of which 4,726, or 0.96% of people, have tested positive for the virus. As I always mention, samples from all of the country's provinces and the Isle of Youth Special Municipality were tested. 277 from Pinar del Rio, 316 from Artemisa, 4,265 from Havana, 179 from Mayabeque, 353 from Matanzas, 106 from Cienfuegos, 243 from Villa Clara, 710 from Sancti Spiritus, 418 from Ciego de Ávila, 182 from Camagüey, 441 from Holguín, and so on and so forth from all of the country's territories. Of the 42 positive cases diagnosed yesterday, 41 are Cubans and 1 is an imported case. 31, or 73.8% of the 42 positive cases yesterday are confirmed case contacts. This means that 89.6% of all diagnosed cases in Cuba since the start of the pandemic had contact with someone who had previously tested positive for the virus. Of the 42 cases diagnosed yesterday, the source of infection linked to 10 is yet to be determined. 6 in Ciego de Ávila, 3 in Camagüey, and 1 in Havana. Work is underway, however, to locate the source of infection in all pending cases. For example, of the 80 cases reported over the last 15 days, the source of infection has been identified in 22, with only 58 still pending. Yesterday, one person to have tested positive for the virus contracted it abroad. Of the 42 diagnosed cases yesterday, 17 are male for 49.7% of all cases, and 25 are female, representing 50.3% of all diagnosed cases on the island. 30, or 71.4%, of the 42 cases yesterday were asymptomatic at the time of testing. Overall, therefore, 58.7% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure rises to 62.01% of cases reported over the last 15 days. By age group, 4 positive cases diagnosed yesterday are under the age of 18, for a total of 488 children, or pediatric cases, to have tested positive for the virus in the country. 420 of the 488, or 86.1%, have recovered from the virus and been discharged from hospital. Meanwhile, 14 people diagnosed with the virus yesterday are between 20 and 39 years of age. 18 cases are between 40 and 59, and 6 are over the age of 60. Of the 42 cases diagnosed yesterday, 17 belong to Havana, including 1 imported case which belongs to the municipality of Playa, 9 to Ciego de Ávila, 5 to Matanzas, 4 to Artemisa, 3 to Sancti Spiritus, 3 to Camagüey, and 1 to Holguín. Of the 41 autochthonous cases, the 4 from Artemisa belong to the municipalities of San Cristobal, with 2, Candelaria, 1, and San Antonio with 1 case. The 5 cases from Matanzas all belong to the municipality of Cárdenas. The 3 cases diagnosed in Sancti Spiritus belong to the municipalities of Yaguajay with 2 and Hatibonico with 1 case. The 9 cases from Ciego de Ávila belong to the municipalities of Ciego de Ávila with 5, Majagua 3, and Venezuela with 1 case. The 3 cases from Camagüey all belong to the municipality of the same name. The case from Holguín belongs to the municipality of Holguín, and the 17 cases from Havana belong to the municipalities of Boyeros with 5, Centro Habana with 3, 10 de Octubre and Cotorro with 2 each, and 1 each from Plaza de la Revolución, Arroyo Naranjo, Habana Vieja, Regla, and Plaza, as well as the imported case from Playa, which does not figure on this list as it is not the result of local transmission. Yesterday's results therefore mean that Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 37.98, slightly higher than yesterday. Havana follows with a rate of 19.34, lower than yesterday. Artemisa has a rate of 13.40. Matanzas rate rises to 4.17. Pinar del Rio has a rate of 1.37. Mayabeques stands at 2.60. Sancti Spiritus rate rises to 3.00. Cienfuegos has a rate of 0.49. And Las Tunas with 0.00. This means that Cuba's rate stands at 6.40 per 100,000 inhabitants over the last 15 days. To summarize, of the 4,726 people who have been diagnosed with the virus thus far in Cuba, 576, or 12.2%, are active hospitalized cases. Of these 576, 559, or 97%, are clinically stable. Yesterday, no COVID-19 related deaths occurred in the country, meaning that the COVID-19 death toll on the island remains at 108, with a mortality rate of 2.28%, lower than the global rate of 3.19% and regional rate, which stands at 3.44%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 110 people were discharged from hospital, a positive result. 68 in Havana, 11 in Ciego de Ávila, 7 in Artemisa, 8 in Matanzas, 6 in Las Tunas, 3 in Pinar del Río, 3 in Guantánamo, 2 in Granma, 1 in Mayabeque, and 1 in Cienfuegos. This means that, to date, 4,040 people, or 85.5% of all confirmed cases in Cuba, have recovered from the virus. Today, 5 patients continue to be in a critical state, one of whom is being treated in Havana, another in Ciego de Ávila, and 3 in Camagüey. 12 patients are also reported as serious, 7 in Havana and 5 in Camagüey. Yesterday, 1 serious patient passed to critical, 2 critical patients to serious, and 4 from serious to closely monitored. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 286,031 people were diagnosed with the virus, for a total of 28,802,775 confirmed cases since the start of the pandemic. Yesterday, 4,927 people died of the virus, for a total of 920,931 COVID-19 fatalities and a mortality rate of 3.19%. The region of the Americas, which accounts for 51.54% of all cases worldwide, reported 117,630 new cases yesterday, for a total of 14,847,457 people to have been diagnosed with the virus. Meanwhile, 2,712 people died of the virus in the region yesterday, for a death toll in the Americas of 512,221 and a mortality rate of 3.44%. The United States continues to top the list of countries worst affected by the pandemic, with 6,486,108 confirmed cases and 193,701 COVID-19 fatalities. India follows with 4,754,356 cases and 78,586 fatalities, with 1,114 reported yesterday. Then comes Brazil with over 4 million confirmed cases. Russia comes in 4th place with 1,057,000 cases. From the Americas, after the United States and Brazil, comes Peru, then Colombia, Mexico with a high death toll, then Argentina, Chile, Canada, Bolivia, Ecuador, the Dominican Republic, Panama, and Cuba, which occupies 21st place in the region. This is the information that we have on the behavior of the pandemic in Cuba and the world.